Hey everyone, and welcome back to my channel. Today we're diving into a topic that might seem confusing: experiencing signs of pregnancy, even when you're having what seems like your period. While a period usually means you're not pregnant, there are instances where you might experience bleeding during pregnancy that can be mistaken for a period. Everybody is different, so it's important to listen to your body and pay attention to any unusual symptoms. In this video, we'll explore surprising signs of pregnancy you might experience even if you're bleeding. We'll delve into why these symptoms occur and when to consider taking a pregnancy test or consulting your doctor. One common sign of early pregnancy is implantation bleeding. This happens when the fertilized egg attaches to the uterus lining, usually 6 to 12 days after conception. Implantation bleeding is typically lighter than a regular period, often pinkish or brownish. Some women naturally have lighter periods, so it's easy to mistake implantation bleeding for a regular period. If you notice other symptoms like fatigue, breast tenderness, or nausea, take a pregnancy test to be sure. Implantation bleeding doesn't last as long as a regular period, usually only a day or two. If you experience brief bleeding that seems different from your usual flow, consider the possibility of pregnancy. Noticing a difference in your bleeding patterns is reason enough to pay attention. It's always better to err on the side of caution and get checked out by a healthcare professional. Let's talk about another classic pregnancy symptom: nausea and vomiting, often referred to as morning sickness. This is associated with hormonal changes during pregnancy, particularly the increase in HCG. Morning sickness can occur at any point during pregnancy, even if you're experiencing bleeding that resembles a period. If you're experiencing nausea and vomiting along with bleeding, especially with other symptoms like breast tenderness or fatigue, consider the possibility of pregnancy. A simple pregnancy test can provide clarity. Consult with a healthcare professional for proper diagnosis and treatment, regardless of whether you think you might be pregnant. We've all experienced fatigue, but the kind associated with early pregnancy is often a whole other level of exhaustion. This overwhelming tiredness is largely due to hormonal changes, especially the surge in progesterone. This extreme fatigue can occur whether or not you're experiencing bleeding. Fatigue on its own isn't necessarily a sign of pregnancy, but when combined with other symptoms like light bleeding, nausea, and breast tenderness, it's a red flag. If you're feeling completely drained and experiencing unusual bleeding, consider taking a pregnancy test. Your body might be trying to tell you something. Breast changes are common during pregnancy and often one of the earliest signs. These changes are driven by fluctuating hormones, specifically estrogen and progesterone. PMS can cause breast tenderness, but pregnancy-related changes tend to be more pronounced. Your breasts might feel heavier, fuller, or even achy. You might notice that your nipples are more sensitive or that the areola becomes darker. These changes can occur even if you're experiencing bleeding that seems like a period. If your breasts feel different than usual, even if you're bleeding, don't dismiss it as PMS. Track your cycle and pay attention to any changes in your body. Frequent urination is another common early pregnancy symptom. You might find yourself needing to pee more often, even if you haven't been drinking more fluids. This is due to hormonal changes, particularly the rise in HCG, which increases blood flow to your kidneys. As your uterus grows, it also puts pressure on your bladder. Frequent urination can occur even if you're experiencing bleeding that resembles a period. If you're constantly making trips to the bathroom and noticing other symptoms like fatigue or light bleeding, consider the possibility of pregnancy. Stay hydrated and consult with a healthcare professional to rule out any underlying medical concerns. Experiencing signs of pregnancy even with bleeding is possible. Our bodies are complex, and sometimes the signals they send can be confusing. The most important takeaway is to listen to your body and trust your instincts. If something feels off or different than usual, don't ignore it. Pay attention to those subtle cues, track your cycle, and reach out to your healthcare provider if you have any concerns. Early detection is key, and understanding the potential signs and symptoms of pregnancy can empower you to make informed decisions about your health and well-being.